Welcome to QD video brought to you by RheumNow.Live, a meeting designed to grow your mind and change your practice. Yes, you'll leave Fort Worth with a really big head. Today's case is hemoptysis in lupus. Holy moly, what's going on there? 43-year-old gal who's I've been taking care of. She's got fairly stable lupus, aches and pains, skin, some serologic stuff, doing well on Plaquenil. Been in a drug study and taken care of by my partner, and haven't heard from her in a while, but she called the clinic saying, I'm doing lousy, I got bad hip pain and my elbow hurts and my foot's kind of sore. Well, what do you want to do with my medicines? And oh, by the way, on Saturday I coughed up a bunch of blood. What? What have you done about it? It's now Monday. 2 days, 3 days have passed and nothing. I mean, so you get into panic mode because hemoptysis is obviously going to be serious. We're going to talk about that. So of course we told her, either you go to the emergency room or your PCP or you see us today. But I'm at work today. So she comes in, we see her, we get a chest x-ray on her, we evaluate her. All is good. Her lupus is stable. She does not look sick. Chest x-ray was normal. It was a one-time event. I'm probably not going to know reason why she coughed up a lot of blood, bright red blood, you know, sort of like a palm full, and not sick. Again, sort of, we'll just say that I asked every question in the books. I want to go over, though, what the differential diagnosis is and the approaches. So the differential, first off, you should know that the greatest worry in lupus is that this is alveolar hemorrhage, which is a dastardly complication of the disease. It happens to people who happen to be sick, who look sick, who are usually febrile, coughing, shortness of breath, can't get their breath back. They have a low PO2. They have a whiteout on chest x-ray. 2/3 of them will present with hemoptysis. But at the end of the hospitalization, hopefully the alive end of the hospitalization, 100% will have hemoptysis. Oh, and if it is alveolar hemorrhage, 50% mortality. That's why you have to jump into action when you see these patients. Even if they don't sound sick on the phone or they don't look sick when you see them, you're obligated to go through these measures and make these considerations. So we got a chest x-ray, we did vital signs, we ordered some bloods, we're waiting on the blood, but she looks really good. I don't think that she has alveolar hemorrhage. Chest x-ray is normal. If they have alveolar hemorrhage, it's a whiteout or a patchy whiteout. So you need to distinguish whether her blood that she coughed up is from her upper airways, nasopharynx, trachea, or is it due to an intrapulmonary process maybe unrelated to her lupus. That would include bronchitis, pneumonia, a pulmonary embolus, TB, or a fungal infection. I think these are all possibilities. In lupus, it's going to be usually alveolar hemorrhage you worry about, maybe a bad case of pneumonitis with some blood. Rarely would this be something like vasculitis or drug-induced, but you got to worry, and someone on an anticoagulant. You know, the list is long, including heart failure, valvular disease, from my residency days, paragonamyosis, haven't seen it, still waiting. So again, is it from the lung or above the lung? And the evaluation is, lupus causes usually look sick, meaning they are very short of breath. They have tachypnea. They have a fever that's usually 103, 104, even higher. And again, when you look at their labs, things change, and they have evidence of active lupus. Such was not the case here, and that's the good news. But again, I think the lesson here is you need to jump to action when the chief complaint is hemoptysis. Tune in for more QD videos. Bye.